Afternoon, sir. My name is Anaesthetics Promise, and I'll be discussing on the mechanism of action, uses and difference between local and general anesthetics. First of all, I'll be defining anesthesia. Anesthesia refers to the medically induced state of partial or complete loss of sensation, pain, or consciousness to facilitate surgical or diagnostic procedures. The term derives from the Greek word an, which means without, and aesthesis, sensation. Anesthesia can broadly be categorized into local, regional, and general types, each serving distinct purposes based on the procedure and patient's needs. Local anesthesia numbs a specific area. Regional anesthesia affects a larger body region, while general anesthesia induces a reversible state of unconsciousness and anesthesia across the entire body. Importance of anesthetics in medicine. Anesthetics are cornerstone tools in modern medicine, enabling complex surgeries, pain management, and diagnostic interventions with minimal patient discomfort. The development of anesthetics have revolutionized surgical practice, reducing mortality and morbidity associated with pain and stress during procedures. For instance, general anesthesia allows for invasive surgeries like cardiac or neurosurgery, while local anesthetics are critical in outpatient procedures such as dental work or minor skin surgeries. Beyond surgeries, anesthetics plays a role in critical care sedation and chronic pain management, improving patient outcomes and quality of life. The ability to tailor anesthesia to patient-specific factors such as age, comorbidities, and procedure type underscores its significance in personalized medicine. We have the overview of local and general anesthetics. Local anesthetics are drugs that reversibly block nerve conductions in a specific area, preventing pain sensation without affecting consciousness. They work by inhibiting sodium ion channels in neuronal membranes, thus preventing action potential propagation. Common agents include isocaine and procaine, administered via topical application, infiltration, or nerve block. Local anesthetics are widely used in minor procedures such as suturing, biopsies, and dental treatments, and are favored for their rapid onset and minimal systemic effects. While general anesthetics induce a reversible state of consciousness, anesthesia, and muscle relaxation, making them essential for major surgeries. They act on the central nervous system, primarily by enhancing inhibitory neurotransmission or inhibiting excitatory pathways. General anesthetics can be inhaled, example isoflurane, or administered intravenously, example propofol. Their uses is critical in procedures requiring complete patient immobility and unawareness, such as abdominal or orthopedic surgeries. Key distinctions. The primary difference between local and general anesthetics lies in their scope and effect. Local anesthetics target specific nerves, preserving consciousness, while general anesthetics affect the entire body, rendering the patient unconscious. The choice between them depends on the procedure complexity, duration, and patient factors. Subsequent sections of this seminar will delve into their mechanism, clinical applications, and comparative analysis. Local anesthetics. Local anesthetics are pharmacological agents that reversibly block nerve condition in a specific area of the body, resulting in temporal loss of sensation, particularly pain, without affecting consciousness. Then we have the mechanism of action, sodium channel blockade. Local anesthetics exert their effect by binding to voltage-gated sodium channels in neuronal membranes, inhibiting sodium ion influx. This prevents the generation and propagation of action potentials, effectively blocking nerve condition. The binding is use dependent, meaning it's more effective in rapid firing neurons, such as transmitting pain signals. Nerve condition inhibition. By stabilizing the neuronal membrane, local anesthetics preferentially block smaller fibers before larger myelinated fibers. The differential blockade results in loss of pain sensation while preserving other function, depending on the dose and concentration. The reversibility of this effect ensures that sensation returns once the drug is metabolized or diffuses away from the site of action. Types of local anesthetics: esters anesthetics, amide anesthetics. The anesthetics, esters such as procaine are metabolized by plasma. They have a shorter duration of action and are more likely to cause allergic reaction due to their metabolite. Procaine is commonly used for infiltration anesthesia, while tetracaine is preferred for spinal anesthesia due to its potency. Amides such as iodine are metabolized by the liver and have a longer duration of action. They are less likely to cause allergic reaction and are widely used in clinical practice. Administration method: local anesthetics are administered through various techniques depending on the procedure and target area. We have the topical method, infiltration method, nerve block. Topical anesthetics, example, iodine cream, are applied to the skin or mucous membrane to numb superficial tissues. They are used for minor procedures, like laser treatment. Infiltration involves injecting the anesthetics directly into the tissue at the procedure site, commonly used for wound suturing or minor excisions. Nerve block. Nerve blocks target specific peripheral nerves or nerve plexuses, providing anesthesia to a larger area such as a limb. Examples include brachial plexuses block for arm surgery. We have the epidural and spinal. Epidural and spinal anesthesia involve injecting anesthetics into the epidural space, respectively, to anesthetize larger region, such as the lower body during childbirth or orthopedic surgeries. Clinical uses of this local anesthetics: we have the minor surgical uses, dental procedures, pain management, side effects and risks. Clinical uses: minor surgical procedures. Local anesthetics are essential for procedures like skin biopsies, laceration repairs and excision, allowing outpatient treatment with minimal recovery time. Dental procedure: lidocaine and atticane are staples in dentistry for procedures like tooth extraction and root canals, providing effective pain control. Pain management: local anesthetics are used in chronic pain management, such as nerve block for neuropathic pain or epidural infusion for postoperative anesthesia. Side effects and risks: while generally safe, local anesthesia can cause side effects including localized reaction, example swelling, and systemic toxicity if absorbed in large amounts. Local anesthetics can lead to neurological symptoms, example seizures and dizziness, or cardiovascular complications, examples hypotension. Allergic reactions are rare but common with esters due to PABA, or other risks include nerve damage from improper injection. Carefully dosing, monitoring and adherence to maximum recommended doses are critical to minimize these risks. One for general anesthetics. General anesthetics are pharmacological agents that induce a reversible state of unconsciousness, amnesia and anglia, and muscle relaxation, allowing for major surgical or diagnostic muscle relaxation, allowing for a major surgical or diagnostic procedures. These drugs act systematically, affecting the entire central nervous system (CNS) to produce a controlled loss of awareness and responsiveness. General anesthetics are characterized by the ability to provide a balanced state of anesthesia, ensuring patient immobility, pain relief, and hemodynamic stability during invasive interventions. Mechanism of actions: effects on central nervous system. General anesthetics primarily targets the CNS, depressing neuronal activity to achieve unconsciousness. They act at multiple sites, including the cerebral cortex, thalamus and spinal cord, to disrupt sensory processing and motor response. The precise molecular targets vary by agent, but the overall effect is a dose-dependent suppression of CNS function. Modulation of neurotransmitters. Most general anesthetics enhance inhibitory neurotransmission or inhibit excitatory pathways. For example, GABA receptors. Inhaled anesthetics, example isoflurane, and intravenous agents. Example, propofol, N- NMDA receptors. Agents like ketamine inhibit excitatory NMDA receptors, reducing glutamate-mediated neuronal excitation. This dual modulation disrupts normal neural communication, leading to unconsciousness and amnesia. Types of general anesthetics. General anesthetics are classified based on their route of administration into inhaled and intravenous agents. Inhaled anesthetics. Inhaled anesthetics such as isoflurane and desflurane are volatile liquids or gases delivered via inhalation. They are rapidly absorbed through the lungs and distributed to the brain, offering precise control over the depth of anesthesia. Sevoflurane is preferred for induction due to its pleasant odor and rapid onset, while isoflurane is commonly used for maintenance due to its cost effectiveness. Intravenous anesthetics. Intravenous anesthetics including propofol, thiopental, and ketamine are injected directly into the bloodstream. Propofol is widely used for induction and maintenance due to its rapid onset and short duration, making it ideal for outpatient procedures. Ketamine is unique for preserving respiratory function and is used in emergency settings for patients with hemodynamic instability. Administration method, induction and maintenance. General anesthesia typically involves two phases: induction and maintenance. Induction, intravenous agents, example propofol, or inhaled agents, sevoflurane, are used to rapidly achieve unconsciousness, while for the maintenance, inhaled anesthetics on continuous intravenous infusion maintain anesthesia throughout the procedure, adjusted based on patient response and surgical needs. Monitoring during anesthesia. Anesthesia depth and patient safety are monitored using parameters like heart rate, blood pressure, oxygen saturation, and end-tidal CO2. Advanced tools such as biospectral muscle relaxation are required. Diagnostic procedures. Procedures like MRI or endoscopy often require general anesthesia, particularly in pediatric or anxious patients, to ensure immobility and comfort. Sedation in critical care. Intravenous anesthetics such as propofol or midazolam are used for sedation in intensive care units to facilitate mechanical ventilation or manage agitation. What are the side effects and risks of general anesthesia? We have general anesthesia carries risks including respiratory depression, hypotension, and postoperative nausea and vomiting. Inhaled anesthetics may cause airway irritation or malignant hypothermia, a rare but life-threatening condition triggered by agents like halothane. Intravenous agents like propofol can cause injection pain or propofol infusion syndrome in prolonged use. Other risks include intraoperative awareness, conjunctive dysfunction, and delayed recovery. Careful patient selection, monitoring and titration of dose mitigates their risk. Mechanism of action. Mechanism of action of local and general anesthetics. Local anesthetics are pharmacological agents that reversibly block nerve conduction in a specific region of the body, resulting in temporal loss of sensation, particularly pain, without affecting consciousness. Sodium channel blockade. The primary mechanism of local anesthetics involves the inhibition of voltage-gated sodium channels in neuronal membranes. These channels are critical for the initiation and propagation of action potentials. Local anesthetics such as lidocaine and bupivacaine bind to the intracellular portion of sodium channels in their open or inactivated states, preventing sodium-ion influx. Then we have factors influencing action. The efficacy of local anesthetics is influenced by factors such as pH, tissue vascularity, and the anesthetic chemical properties. Example, lipid solubility. For example, in acidic environments, e.g., in infected tissues, the ionized form of the anesthetics predominates, reducing its ability to penetrate nerve membranes and bind sodium channels. Lipid soluble agents like bupivacaine Liquid agents like bovicain and have greatest potency and longer duration due to enhanced membrane. Okay. Yes, sir. Bupivacaine. Okay. Bupivacaine have greater potency and longer duration due to enhanced membrane penetration. General anesthetics overview. General anesthetics induce a reversible state of unconsciousness, anesthesia and anesthesia and muscle relaxation by acting on the central nervous system (CNS). Their systemic effects make them suitable for major surgical procedures requiring complete patient unawareness and immobility. We have comparison of local and general anesthetics. Mechanism of action: local versus the general anesthetics. Local anesthetics act by reversibly blocking voltage-gated sodium channels in peripheral nerve membrane,
3 minutes to go,
preventing the generation and propagation of action potentials in specific area. This results in localized loss of sensation, primarily targeting pain and temperature fibers. For example, lidocaine inhibits sodium influx in sensory neurons, ensuring analgesia without systemic effect. Then we have clinical applications. Local anesthetics are ideal for minor outpatient procedure where only a specific area needs to be numbed. What are the key difference between these two? Local anesthesia are used for localized minor procedures, while general anesthetics are suited for major systemic interventions. In conclusion, this seminar has explored the mechanism, applications, and distinction between local and general anesthetics, highlighting their critical roles in modern medicine. Local anesthetics, such as lidocaine, act by blocking sodium channels in peripheral nerves, providing targeted analgesia for procedures like dental work. Importance of choosing the right anesthetics. Selecting the appropriate anesthetics is a critical decision that impacts patient safety, procedural success, and recovery. Local anesthetics are preferred for outpatient and minor procedures. The field of anesthesia is poised for significant advancement. Research into novel agents such as remonoxalam for sedation of chiral anesthetics which reduce toxicity promises safer and more efficient options. Thank you.
What are you doing? Clap well now if you want to clap. All right, thank you very much for the presentation. That was a wonderful presentation, detailed, and in fact, you hit it. I am impressed, but I want to highlight one or two things. This topic would have ended on this 14th minute itself, but you were repeating yourself. In fact, you repeated the mechanism of action up to 4 times. You also repeated the difference up to 4 times. Why? You didn't articulate the thing well, or what? This presentation goes straight to the point, hit it, organize your work well so that once you come out, you hit it, not repeating yourself all over and all over and all over again. Okay? But apart from that, that was a good work. Please, let's clap for him again. All right. Thank you very much.